So today I'd like to take a little bit of time to talk to you about muscle pain and tendon pain. Um, Depending on which muscle and which tendon is irritated, the management and advice is often very different. So this is going to be more of a general overview about it. And to start off with, I want to talk a little bit about the anatomy of things. With muscles, most people are familiar with muscles. We obviously use them for moving around and anything that requires movement basically throughout our body. With tendons act more as the anchor points for the muscle. So with things like your biceps, you've got tendons that attach either side of the biceps up into the shoulder and down past the elbow to be responsible for the movement. I often explain it to patients like if I wanted to open the door and I had a rope attached around the door handle, if I pull on the rope to move the door, the tendon is the rope and I am the muscle doing the pulling. The tendons don't do the pulling, they're the ropes that kind of allow the muscle to pull on them to get things to move. Hopefully that makes sense anyway, but that's how I normally explain it to patients. Because they work as a unit together, when muscles get stronger, tendons get stronger. When muscles get weaker and deconditioned, tendons can become deconditioned as well. And one of the main reasons why these tissues can become irritated or damaged in some cases is by the principle of overload. So if you push a muscle or a tendon beyond what it's happy to do, it can get uncomfortable. And obviously going to the far extremes of things, if you really do push them, you can get tears in the muscle, tears in the tendon and things like that. It's less common to get a full-blown rupture of the tendon and muscle. More commonly, we see irritations in them. And sometimes it can be the muscle that gets irritated, sometimes it can be the tendon. It all kind of depends on on the nature of how this will come about. But it can be through one bout of doing more activity or stress and strain through the tendons and they're happy with, or it can be an accumulative load going on over time. But the majority of these things happen due to a repetitive strain or an overload of these tissues where they're not happy about it. Where things get a bit more nuanced is muscles generally have a really good blood supply, and if you strain them, irritate them, usually they can be a bit quicker to move in the right direction. Tendons, on the other hand, their blood supply isn't quite as good. Therefore, when they get irritated, they become a bit more sensitive. It can be a bit harder to move them in the right direction with it as well. But generally speaking, overloading too much strain through them is the catalyst that kind of irritates them. But also that exercise and activity can be the thing that we can use to push it back in the right direction. It gets very difficult though, because as I said, this is the thing that started off in the first place. The problem with it is if you go too aggressive with exercise, it can make things more sensitive. You go too gentle, it doesn't change it. So it's a very fine balance to try and find the sweet spot. That's often why physios are quite useful, to be able to look at the pattern, look at the specific muscle, look at the specific tendon, see where that land lies, what's going to be the right amount of exercise, the least amount of exercise, and making a bespoke plan about about how we're going to get things moving in the right direction. The other thing is that as much as exercise is usually the gold standard for these treatments, there are other things that can help push things in the right direction as well. Muscles tend to like things like massage and ultrasound and acupuncture and things like that. Ultrasound can work for tendons, but shockwave tends to be a bit more effective, and things like taping can be really useful for it as well. It does go into a lot more detail than that. This is just a bit of a general overview on the subject, but if you do have any specific muscle or tendon issues that are holding you back, please feel free to contact us and we can have one of our physiotherapists assess the area for you as well. If you have any further questions, don't hesitate to contact us, and hope you have a good day. Thanks. Take care.